Hello everyone, my name is Michaela and today I'm going to be talking about the effect PTSD has on sleep and dreams. First, an overview. What is PTSD? PTSD, also known as post-traumatic stress disorder, is a complex mental health condition that starts after a traumatic event, or sometimes multiple events. Symptoms include flashbacks, anxiety, depression, and sleep issues. Next, what are dreams? Dreams are what happen during sleep, specifically REM sleep. Dreaming is when memories are processed, often emotional memories. Sleep is often one of the things PTSD affects. One article by Aaron Tendler explains how around 90% of patients have sleep disturbances as a symptom of PTSD. So, what sleep problems are associated with PTSD? First, flashbacks or nightmares can occur, where while sleeping, the traumatic event they've experienced can replay in a dream form. This causes extreme distress, which can lead to stress around sleeping or insomnia, due to the fear of reliving the traumatic event while sleeping. Substance abuse can also be an issue due to someone with PTSD trying to find something that they can help them sleep. So, why does this happen? From a neurochemical level. Some neurochemicals involved in sleep are acetylcholine, which is high when someone is awake or asleep and can signal for dreams to occur. Next is serotonin, which is high when awake and low when sleeping. And finally, norepinephrine, which plays a key role in how those with PTSD are affected during sleep. It is common for people to have low levels of norepinephrine when sleeping, but for people with PTSD, norepinephrine levels are higher, which attributes to sleep disturbances. Another level that can explain this is neuroanatomy. PTSD causes changes in the prefrontal cortex, amygdala, and hippocampus. Often, PTSD causes a positive feedback loop where, due to decrease in sleep, it decreases the ability to emotionally regulate, which causes the amygdala function to alter, therefore causing the prefrontal cortex and amygdala to have decreased functional communication. Amygdala function is decreased in those with PTSD, causing emotional reactivity. In addition, the theta band is important for memory processing, especially during sleep, which is altered in those with PTSD. So, how do these symptoms work together? The cortical limbic and hypothalamic adrenal pituitary axis struggle with communication due to the effects PTSD has on the amygdala, due to the stress the disorder has on the brain. As mentioned previously, flashbacks and nightmares can cause decreased sleep, which causes the amygdala to be hyperactive, increasing stress and miscommunication between the parts of the brain. In addition, the stress PTSD causes can affect the circadian system, and they are closely connected. Decreased sleep and extreme stress put stress on the heart. One study by Agoratos and Olof explains how circadian disruption and sleep issues can be a large factor of how PTSD is managed. One method of research that can be used to see effects PTSD has on sleep is an EEG. This research method can be used to see brain activity during sleep, as well as seeing the stages of sleep. One study by Tendler explored if brain neurofeedback could help treat sleep problems from PTSD. They used an EEG for this study as well as an fMRI and tracked amygdala activity and emotional activation. Overall, PTSD is a complex mental health condition with many symptoms. Sleep disturbances are one of the most common issues those with PTSD face, and they often go unsolved or untreated due to the complexity of sleep issues. Thank you for listening, and here are my sources.